Colchicine is actually an old drug that was initially extracted from a plant. It's a powerful anti-inflammatory agent that has been used for decades to treat gout and, more recently, pericarditis. Even more recently, there was a relatively small study that tested the effects of colchicine in patients with stable coronary disease, the low-dose study, that actually showed benefits in patients with stable disease in terms of reduced cardiovascular event rates. Now, we have performed the COLCOT trial. COLCOT stands for Colchicine Cardiovascular Outcomes Trial, to test whether the addition of the anti-inflammatory colchicine would reduce rates of recurring cardiovascular events after a heart attack, a myocardial infarction. And so COLCOT recruited 4,745 patients with a recent myocardial infarction within the last 30 days. Patients received the standard of care, that is antiplatelet agents, statins. The patients got angioplasty, PCI, if it was planned, and they were then randomized to receive either low-dose colchicine, 0.5 milligrams per day, or placebo. The pre-specified primary efficacy endpoint in COLCOT was the composite of cardiovascular death, resuscitated cardiac arrest, myocardial infarction, stroke, or urgent hospitalization for angina requiring coronary revascularization, and this was analyzed in a time to first event analysis. The primary efficacy endpoint in COLCOT, which was this composite, was significantly improved by the addition of colchicine versus placebo on top of standard of care. There was a 23% relative risk reduction in favor of colchicine versus placebo in this composite endpoint. Now, we also evaluated the per protocol population of patients without major protocol deviations, and in that population, the primary efficacy endpoint was even more improved by colchicine. That is a 29% relative risk reduction with colchicine versus placebo. Finally, we also looked at the total burden of ischemic events, that is both first and recurrent ischemic events, and colchicine reduced the risk of this entire burden of events by 34%, which was highly statistically significant. In terms of validation of the anti-inflammatory hypothesis in patients with coronary disease, so we already have the low-dose study, as I mentioned, a relatively small but highly significant trial that showed that colchicine provided benefits in patients with stable disease. We also have the CANTOS trial that used a monoclonal antibody to interleukin-1, which also showed benefits of that agent. And now we have a large trial, 4,700 patients, in the context of a recent myocardial infarction that did show benefits of colchicine versus placebo. So I think the hypothesis has been validated, confirmed, and now it has been done with a drug that is orally administered, inexpensive, safe, and already available. So I think that as clinicians, we can feel comfortable using colchicine in patients with a recent myocardial infarction. I believe there are several important lessons learned from COLCOT. A, the magnitude of the benefit, up to 34% for the overall burden of events with colchicine versus placebo, was a surprising finding. B, the drug was very well tolerated. As clinicians, not uncommonly, when we think of colchicine, we think of diarrhea and GI upset. And it turns out here that the incidence of diarrhea was not different with colchicine compared to placebo. Now, there was a small increased incidence of nausea with colchicine versus placebo, but that was less than 2%. And finally, there was also a small but significant increase in risk of pneumonia, but that was even less than 1%. So all in all, I believe that we've learned a lot from this trial with a drug that can immediately be used. And finally, the other lesson is that we did this trial COLCOT in patients with a recent heart attack, a recent myocardial infarction, but I would not be surprised that other types of patients may benefit from colchicine. And so I think there is a need for additional trials to test other populations, and to that end, we are actually going to launch very soon the COLCOT T2D trial, where we will test this anti-inflammatory colchicine in 10,000 patients with type 2 diabetes, but this time without coronary disease, and therefore we will be testing this in patients with high-risk primary prevention.